Administering medications in the athletic training setting. After exploring this content, students should be able to recognize the guidelines regarding medication administration that athletic trainers and other sports medicine clinicians must adhere to, implement policies and procedures for medication administration in the athletic training clinic, identify key components of a physician's prescription pad and common Latin abbreviations, identify potential errors in prescribing medication, list the information included in a medical order or prescription, and list the strategies for avoiding or preventing a medication error. Sports medicine facilities may include the traditional athletic training setting or clinic, as well as other performance venues, event sites, team buses, or hotels as needed. Traditional settings may include high schools, colleges, and professional sports. Emerging settings may include the industrial setting, military, police, fire, and entertainment locations. As has been previously discussed, the DEA requires registration required to store controlled substances. Athletic training facilities may dispense non-controlled substances, such as oral antibiotics. These medications must be properly labeled, packaged, and stored in a secure facility, but do not require a DEA registration process. The Board of Certification, or BOC, policies and procedures are required to manage medications and are essential to the professional practice of athletic training. We must establish straightforward policies and procedures. Policies and procedures should be developed to minimize misunderstandings. We mandate athletic trainers stay current regarding compliance to laws. These policies and procedures should be reviewed annually, and a copy should be filed with the appropriate administrators. The guidelines for administering medications. The guidelines for administering medications in the athletic training setting have been published since 1992 and emphasize the schedule of classification of drugs, the role of documentation, and the mandate to follow federal and state laws. Currently, there are CADI standards regarding patient education and the administration of drugs per physician guidelines. There have been documentations of concerns of athletic training compliance in the past, such as the lack of proper storage, athletic training students distributing over-the-counter drugs, and inadequate tracking and documentation of drugs. Treating patients who are minors, the Council on School of Health recommends district-wide policies. The current guidelines recommend no medications be administered for minor patients without parent written consent. Here are the current CADI standards regarding anything related to medication and/or pharmacology. Administrative principles. If considering incorporating prescription medications into an athletic training facility, the members of the medical staff must follow sound administrative principles. These principles apply to prescription medications, particularly controlled substances. The athletic training staff should do the following: develop a medication policies and procedures manual for the athletic training facility or clinic. They need to understand state and federal regulation policies as they apply to athletic training. Federal guidelines supersede state and local statutes relative to managing medications. They need to establish a chain of command. A hierarchy of responsible team physicians and athletic trainers should be established based on which people will be managing medications. Keeping proper records. Maintaining legible, accurate, and complete records is a necessity. Records should cover the name of the patient receiving the medication, when it was dispensed, and a log of the lot number of the batch. Records must be stored in accordance with state and federal laws for at least 3 years. Destroying expired medications. Expired or damaged prescriptions and over-the-counter medications must be rotated out of stock. Expired medications should never be dispensed. A reverse distributor should always be used to dispose of expired inventory. Correctly label all medications. A medication must be used exclusively for the patient for whom it was intended. Medication should never be shared among teammates or given to anonymous patients. Securely lock medications and controlled substances. All medications should be stored in locked cabinets with limited access to athletic trainers and team physicians. Controlled substances should have a higher level of scrutiny. For example, they should be stored in an area that only physicians can access. Medication cabinets must be placed in a physician's office within the athletic training facility and not in the general traffic areas. And providing sample medications. These are prepackaged medications with a limited number of doses that are convenient to administer. Samples may help reduce cost, but they must be properly documented with a paper trail when being brought into the athletic training facility. This level of documentation acknowledges when the samples were incorporated into the clinic, as well as the patient receiving the medication. Samples are owned by a licensed physician and must not leave the facility. Drug orders. An athletic training clinic or facility must have the exact guidelines for the physician orders. A standing order. The drug is to be administered until discontinued or for a certain number of doses. A stat order. This is a one-time order to be given immediately. A single order. This is a one-time order to be given at a specified time. A PRN order is given as needed based on a patient need. Packaging prescription medications in the athletic training facility can pose several concerns. Historically, tablets or capsules were transferred from stock bottles into small pill envelopes. This process is considered repackaging and does not meet the standards set forward by the U.S. Food and Drug Administration. The United States Department of Health and Human Services considers repackaging as the act of taking a finished drug produced from the container in which it was distributed by the original manufacturer and placing it in a different container without further manipulation of the drug. Additionally, the FDA expresses concerns that the stability, safety, and the efficacy of a drug could be affected by the repackaging. To minimize the repackaging concerns, medications must be administered to the patient in the original container from the pharmacy. Legally, a traditional style medication bottle or blister pack with a specific number of doses may be packaged by the manufacturer, dispensed by the pharmacy, and then administered to the patient in its original and unaltered state. A standardized prescription label is then affixed to the package in the pharmacy or by a physician to add specific instructions for use. An instruction form should be attached specifically for the prescription. A copy of this form should be added to the patient's medical file and its data entered directly into the patient's electronic medical or health record. Filling a prescription. There is core component information that is required on a prescription label. We are typically moving away from Latin abbreviations. However, I have listed some of the common medical abbreviations that you will find in the sports medicine facility and in sports medicine prescriptions. These can be found in the table listed on the right. The more common prescription instructions pertain to the medication's measurement quantity, frequency of taking a medicine, and the drug release technology. Athletic trainers should be familiar with common medical abbreviations related to sports medicine. A prescription label is the documented record of instructions from the physician to the patient. This form meets the criteria of the dispensing medication from the pharmacist. The core components of the prescription must be on file with the pharmacist and the patient's medical record. Requirements of the prescription are as follows: the prescriber's name, address, phone, and licensure information, the patient's name, the patient's identifying data, such as home address and date of birth, the date the prescription was written, the specific medication name, strength, and number of doses, the specific instructions for use, such as frequency, route of administration, number of refills, and potential warnings associated with the medication. A medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of a healthcare provider, patient, or consumer. Such events may be related to the professional practice, healthcare products, procedures, and systems, including the prescribing, order communication, product labeling, packaging and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and the use of prescription medications. Some of the factors associated with medical errors include medications with similar names or similar packaging, medications that are not commonly used or prescribed, commonly used medications to which many patients are allergic, simultaneous use of multiple drugs to treat a single ailment or condition, or simultaneous use of multiple drugs by one patient, also known as polypharmacy. Medications that require testing to ensure that proper or non-toxic therapeutic levels are maintained. Errors in drug administration can be prevented through various means. As we have talked, using electronic formats for written prescriptions can eliminate a handwritten prescription that can be misinterpreted or lost. Sports medicine practitioners should apply these rights of medication administration to promote medication safety. The right of the patient. Ask the patient their name. Is there a medication prescribed to someone with a similar name or the same name? Could there be confusion with another healthcare provider that is involved? Is it the right drug? Carefully examine the packaging, particularly if this is a new or different medication for the patient. Is the drug name on the label consistent with the physician's order? Is the product description on the pharmacy label consistent with the packaging? Check the contents against the original packaging. Do not repackage the medication. Is it the right dose? Confirm the information listed on the pharmacy packaging by comparing it with the prescriber's orders. Has the medication been properly administered? Have there been omissions, treatment completed, the wrong strength, or even a double dose? Is it the right route? Confirm the intended route of administration by comparing the pharmacy label with the prescriber's orders. Is the drug to be given orally, or instead by injection or intravenously? Is it the right time? Ensure that the drug is administered at the right time. Has the patient skipped a dose? Was the drug administered late? Should the drug be taken with food instead of on an empty stomach? Is it the right documentation? Has the patient been documented to have received the drug? Always record the administration of the drug in the medication log and in the patient's medical record. Also look to make sure that the patient has the right reason and the right response to the drug. In summary, medicines play a role in restoring patient well-being. Athletic Training Administration and staff must adhere to strict state and federal guidelines. A policies and procedures manual should be developed to guide athletic trainers in the administration of medications in the sports medicine facility. Athletic Training Administration must follow guidelines, including federal, state, and local laws. Professional guidelines regarding concerns such as athletic training students and over-the-counter medication should be addressed. And the documentation of medication should be managed consistently at the facility level. Providers and clinicians must give patients clear instruction on the appropriate use and administration of each medication. It is critical to respect patients by following the rights of medication administration.